Hey everyone, and welcome to this deep dive where we're going to take a close look at strokes.
Yeah,
And specifically, we're going to be using some medical texts and nursing guides
that's right.
to really understand, you know, what causes a stroke, what are the signs of a stroke, how are strokes treated,
Exactly.
and kind of a special focus on what nurses do when someone's having a stroke.
Yeah, and we really want to break it down so that it's easy to understand.
Yeah, for sure.
We don't want to get too bogged down in the jargon.
Yeah, so I think first off, what is a stroke?
Well, a stroke, you can think of it like a brain attack.
Okay.
It's when the blood supply to part of your brain is interrupted.
So it's like the brain's equivalent of a heart attack.
Yeah, exactly.
Okay.
And just like a heart attack.
Okay.
Time is of the essence when it comes to strokes.
Right.
Because the longer the brain is deprived of oxygen, the more damage occurs.
So you've got to get help right away.
Absolutely.
Okay, so let's talk about those signs.
Yeah.
What should we be looking for? I know there's that acronym FAST, right?
Yeah, fast is a good starting point.
Okay.
But sometimes focusing just on fast can actually lead people to miss other signs
Really?
that are less common but still important.
Okay, so what are those signs?
So aside from the classic facial drooping, arm weakness, and speech difficulties,
Right.
other things to be on the lookout for are sudden confusion, a very severe headache that seems to come out of nowhere,
Okay.
dizziness, loss of balance, or vision changes like double vision or sudden blindness in one eye.
Wow, so vision problems too,
Yeah.
and in real life.
Different parts of the brain
Right.
control different functions, and so
Right.
some parts of the brain are responsible for processing visual information.
Oh, okay.
So if those areas are affected by the stroke, it can impact your vision.
That makes sense.
Yeah.
Okay, so it's not just one thing. It could be
No,
any of these things that are happening.
it can be a cluster of these signs that might indicate a stroke.
Okay, and these can vary from person to person.
Exactly.
Yeah.
Some people might just experience one or two subtle signs.
Right.
Others might have a more dramatic presentation.
So if we see any of these signs, what should we do?
Call 911 immediately.
Okay, so don't even think about it.
Don't hesitate.
Just call.
Every minute counts.
Got it.
Yeah.
Okay, so we talked about what a stroke is, how to recognize the signs.
Right.
Now I'm curious about the types of strokes.
Okay.
Are there two main categories?
There are ischemic strokes and hemorrhagic strokes.
Okay.
Ischemic strokes are the most common, accounting for about 87% of all strokes.
Wow.
And that happens when a blood clot blocks an artery in the brain.
So that's
You can think of it like a traffic jam in your blood vessels.
okay.
Yeah.
And hemorrhagic.
Hemorrhagic strokes occur when a blood vessel in the brain ruptures, causing bleeding.
Okay.
And so it's more like a burst pipe,
Oh, geez.
leading to blood leaking into the brain tissue.
Okay, so they both interrupt blood flow, but in different ways.
Exactly.
One's a blockage, one's a bleed.
Precisely.
Okay.
And that's important to understand because the type of stroke determines the treatment.
That makes sense.
Yeah.
So let's talk about treatments. What happens when someone arrives at the hospital?
So the first thing that medical professionals do is stabilize the patient.
Okay.
Make sure the airway is clear, breathing is stable, blood pressure is under control.
Yeah.
And then they need to quickly determine what type of stroke it is.
Right.
Because treatment will be different for ischemic versus hemorrhagic.
Yeah, did they do that?
They use imaging studies like a CT scan or an MRI.
Right.
And these scans can show whether there's a clot blocking an artery or if there's bleeding in the brain.
So they're taking a picture of the brain
Okay.
to see what's going on inside.
Exactly.
Once they know which type.
They can tailor the treatment accordingly.
This is fascinating, but also kind of scary.
Yeah.
What would you say is the most crucial thing for our listeners to remember?
Don't hesitate to call 911 if you even suspect a stroke.
Okay.
It's better to err on the side of caution.
Yeah.
The faster someone receives medical attention, the better their chances of recovery.
That's a really powerful message.
Yeah.
So we've talked about what a stroke is, how to recognize the signs, the importance of acting quickly.
Right.
But what happens once someone arrives at the hospital?
Yeah.
What are the treatments that can actually make a difference?
Yeah.
That's what we're going to delve into in part 2
Yeah.
of this deep dive.
Yeah.
So stay tuned.
Welcome back to our deep dive into strokes.
Okay, so the ambulance has arrived,
Yeah.
the sirens have faded, and now we're in the hospital.
Right.
What happens next?
So like you said, time is brain.
What?
So the medical team's going to work very quickly to assess the patient's condition,
Okay.
make sure their airways are clear,
Right.
breathing properly. They'll closely monitor their vital signs,
Okay.
like their blood pressure and heart rate.
Are there specific treatments that are given, like, right away?
Well, if it's an ischemic stroke,
Okay.
which remember is caused by a clot,
Right.
there's a medication called TPA,
Okay, I've heard of that.
which is a clot-busting drug and can really be a game changer.
So how does that work?
You can think of TPA as like a microscopic plumber that goes in,
Okay.
dissolves the clot, and restores blood flow to that part of the brain.
So it's unclogging the traffic jam.
Exactly.
But if it's so effective, why isn't it given to everyone with a stroke?
Well, TPA is a powerful drug,
Okay.
and it has to be given within a specific time window,
Okay.
typically within 4.5 hours of the onset of symptoms.
So that's why it's so important to get to the hospital quickly.
Exactly. It's a race against time.
Wow.
Beyond that 4.5 hour mark, the risks of using TPA start to outweigh the benefits.
That makes sense. What about for hemorrhagic strokes? Is TPA used for those too?
Absolutely not.
Okay.
Giving a clot-busting drug to someone with a bleeding stroke would be disastrous.
Oh, wow.
It'd be like pouring gasoline on a fire.
Okay, yeah, that makes sense. So how are hemorrhagic strokes treated then?
So for hemorrhagic strokes, the focus shifts to controlling the bleeding
Right.
and reducing pressure on the brain.
Okay.
So this often involves medications to lower blood pressure
Okay.
and prevent seizures.
Right.
And in some cases, surgery might be necessary
Okay.
to repair the ruptured blood vessel or to remove the accumulated blood.
So the initial treatment really depends on what type of stroke it is.
Exactly.
What I find interesting is that nurses seem to play a really big role in all of this.
Yeah.
So what are some of the things nurses are doing specifically
Okay.
to care for stroke patients?
Nurses are really the unsung heroes of stroke care.
Okay.
They're constantly monitoring the patient's condition,
Right.
looking for any subtle changes that could indicate a problem.
Okay.
They're administering medications, assisting with basic needs like feeding and bathing,
Right.
and they're implementing therapies to help patients regain lost abilities.
Yeah, it sounds like they wear a lot of hats.
They do, they do. And one area where nurses really excel is preventing complications.
Okay.
Because stroke patients are at risk for things like aspiration pneumonia, pressure ulcers, and blood clots.
Let's talk about aspiration pneumonia.
Yeah.
What is that?
So aspiration pneumonia occurs when food, liquid, or even saliva
Okay.
enters the lungs instead of the stomach.
Okay.
And this can happen if someone has difficulty swallowing due to the stroke.
Oh, okay. So how do nurses prevent that from happening?
Nurses carefully assess the patient's ability to swallow,
Okay.
and they might recommend modified diets
Okay.
with thickened liquids or pureed foods to make swallowing safer.
So it's really about adapting to
Yeah.
the patient's needs and preventing those complications.
Exactly.
Now, what about pressure ulcers?
So pressure ulcers are also known as bed sores,
Okay.
and these can develop when prolonged pressure is placed on certain areas of the body.
Right.
And what happens is it cuts off blood flow to the skin
Okay.
and underlying tissues.
So people who are bedridden or have limited mobility are more susceptible to those.
Right. And so nurses will regularly reposition those patients,
Okay.
keep their skin clean and dry,
Right.
and use special mattresses or cushions to redistribute pressure.
Wow, that's really interesting. Okay, what about blood clots?
So preventing blood clots is crucial
Okay.
because stroke patients are at an increased risk,
Right.
especially if their mobility is limited.
Yeah.
So nurses will often use a combination of strategies, including medications like blood thinners,
Okay.
compression stockings to improve blood flow in the legs,
Right.
and leg exercises to promote circulation.
Even if they can't really move around a lot.
Yeah, they might even just encourage like ankle pumps or foot circles even while the patient's in bed.
It's incredible how much nurses do,
Yeah.
like behind the scenes, to make sure these patients are doing okay. What would you say is the most crucial aspect of nursing care?
I would say their constant vigilance is key.
Okay.
Nurses are like detectives, you know? They're always searching for clues,
Right.
noticing subtle changes in a patient's condition that other people might miss.
They're the eyes and ears of the medical team.
Precisely.
Right.
They're at the bedside, observing, assessing, and advocating for their patients.
So nurses are really indispensable in stroke care.
Absolutely.
But what happens after that initial crisis has passed?
Right.
We know recovery from a stroke can be a long journey.
Yeah.
What are some of the therapies used to help patients regain those lost abilities?
Yeah.
That's what we're going to talk about in part 3 of this deep dive.
Right.
So stick with us. Welcome back to the deep dive. So in the previous parts, we talked about, recognizing the signs of a stroke,
Right.
the importance of getting medical attention right away,
Mm-hmm.
and the role that nurses play.
Yeah.
But now I kind of want to shift gears a little bit and talk about recovery.
Okay.
Because we know that strokes can have lasting effects,
Right.
but there's also a lot of hope
Yes, definitely.
for regaining those lost abilities.
Yeah, the brain is incredibly adaptable.
Right.
And with the right support,
Yeah.
stroke survivors can make remarkable progress.
What are some of the things that influence how well someone recovers?
Well, a lot of factors,
Yeah.
but certainly the severity of the stroke is a major one.
Right, if it's a small stroke.
A small stroke might have minimal lasting effects,
Huh.
while a larger, more extensive stroke
Right.
could lead to more significant challenges.
What about the area of the brain that's affected?
Yeah, that also plays a role.
Because we talked about
Right.
how different parts of the brain control different things.
Different functions, exactly.
Yeah.
So a stroke that affects the area responsible for language
Right.
might lead to speech difficulties,
Okay.
while a stroke in the motor cortex could cause weakness or paralysis.
So the location of the damage really impacts
Yes,
the challenges someone might have.
exactly.
What other factors?
Age and overall health play a part.
Okay.
Younger individuals tend to recover more quickly than older adults. And people who are in good health before the stroke often have better outcomes as well.
That makes sense. So it seems like it's kind of a combination of things
Yes.
that determine how that recovery goes.
Right.
But what about the therapies themselves?
Right.
What can be done to help people regain those lost abilities?
So rehabilitation is the cornerstone of stroke recovery.
Okay.
It's a multidisciplinary approach
Okay.
that involves a team of specialists, including physical therapists, occupational therapists, and speech therapists.
Let's start with physical therapy. What do they focus on?
So physical therapists work with patients to improve their strength,
Okay.
coordination, balance, and mobility.
So really like
Right.
retraining their body to move.
Exactly. The brain might have lost some of its control over certain muscles,
Right.
but through repetition and practice,
Okay.
new neural pathways can be formed,
Wow.
allowing the body to relearn those movements.
That's amazing. What about occupational therapy?
Okay, so occupational therapy focuses on helping people regain the skills they need for daily living.
Okay, so that's like more like
Yeah.
everyday tasks.
Exactly. Things like dressing, bathing, cooking, or using the toilet.
So it's more like adapting to life after a stroke.
Precisely, occupational therapists might suggest adaptive equipment
Okay.
or modify the home environment to make tasks easier and safer.
Wow. That's really helpful.
Yeah.
Okay, now what about speech therapy?
So speech therapists work with patients who have difficulty communicating
Right.
due to the stroke.
Which can happen.
Yeah, this could involve problems with speaking, understanding language, reading, or writing.
So it's not just about regaining speech.
It's a whole range of communication skills. Yeah, and they use a variety of techniques,
Okay.
including exercises, drills, and alternative communication methods.
Wow. Seems like all of these therapies
Yeah.
really require the patient to work hard.
Yes, absolutely. Recovery from a stroke is a team effort.
Right.
The therapists provide guidance and support,
Yeah.
but the patient has to put in the work.
Yeah, they've got to be dedicated.
The repetition, the practice.
Now, I'm curious, what about the role of nurses during this rehabilitation process?
Nurses are a really integral part of that rehabilitation team. They're with
Okay.
the patient 24/7.
Right.
They're monitoring their progress, they're providing encouragement,
Okay.
and they're really helping them navigate those challenges of recovery.
So what are some of the things that they specifically do to help patients?
Well, they might assist with exercises,
Okay.
reinforce the techniques taught by the therapist,
Uh-huh.
and help patients practice those skills throughout the day.
So it's like keeping that momentum going.
Exactly.
Yeah.
And they also play a really crucial role in educating patients and their families
Okay.
about stroke recovery, addressing their concerns, and connecting them with resources.
So it's not just the physical care, they're providing emotional support as well.
Exactly. Stroke can be a very emotional experience,
Of course.
not only for the patient, but also for their loved ones.
Yeah.
And so nurses are there to offer a listening ear,
Okay.
a shoulder to cry on, and just a source of strength.
It sounds like nurses are really the heart and soul
I think so.
of stroke care.
Yeah.
From, the initial part all the way to the long road of recovery.
Yeah, they're there every step of the way.
We've covered so much in this deep dive.
We have.
From like what a stroke is to how it's treated, all the way to, this rehabilitation process.
Right.
What would you say is like the one message you hope our listeners take away from all of this?
Well, I think the most important message is that strokes are serious,
Right.
but they are often preventable.
Okay.
Knowing the risk factors,
Right.
making healthy lifestyle choices, and recognizing those signs early
Right.
can really make all the difference.
And for those who have experienced a stroke,
Yes,
there is hope for recovery.
absolutely. Recovery is a journey.
Yeah.
And with the right support and determination,
Yeah.
amazing things are possible.
That's really powerful.
Yeah.
Well, thank you so much for being here and sharing your expertise.
It's been my pleasure.
I feel like I learned so much.
Good. I'm glad.
And I hope our listeners did too.
Me too.
So that wraps up this episode of The Deep Dive.
Thanks for listening, everyone.
We hope you found it informative and engaging,
Yeah,
and that you learned a lot about strokes.
absolutely.
And remember, stay curious, stay informed, and take good care of yourselves.